Hi, this is Dr. Tom McFadden of Advanced Cosmetic Surgery. We're here in Greenville, South Carolina. We do the full gamut of surgical and non-surgical cosmetic procedures here. And let's see what video topic we're going to cover today. Hi, this is Dr. Tom McFadden at Advanced Cosmetic Surgery, and we're going to talk today about tummy tuck scars. What makes a good one, what makes a bad one. So here we are. This is a gal that I did many years ago, and again, the perfect tummy tuck candidate. She has really no fat, no liposuction was needed whatsoever. Just has lots of loose skin, had twins and had a third child, and so just has loose skin, needs to come off, and we need to tighten her muscles. She actually did have some diastasis recti, or separation of the rectus abdominis muscles. A lot of people talk about it, but she really had it, and she had it about 9 centimeters or so. In any case, she had the tummy tuck done. She healed beautifully. She has very smooth contours on the side and a very flat abdomen in the front. Her scars are virtually imperceptible. So why is that? Well, the answer is it's mostly your genetics. There are some things that we can do to help the scars and improve them, make them better over time, but if nature's not going to allow it, it's just not going to happen, or you're going to have a lot more difficulty getting there. So, her genetics were good. The number one principle that we adhere to here in terms of helping the wound heal as smoothly and as cosmetically appealing as possible is to keep it from drying out. Do not let it dry out. Keep it moist. We put on some strips on the first week so that happens no matter what you do. After that, it's very important to keep it moisturized. You can do that with any number of things: Vaseline, Neosporin. You can use other lotions. It really doesn't matter that much as long as you adhere to that principle for the most part. Silicone strips down the road can apply low-grade pressure, also retain the native moisture, and those things help as well. So here she is. She's got a great scar. She can wear a low-cut bikini. She's got a very flat abdomen, and she was very pleased with this result. Here's another one that actually did heal very well, okay? She's a darker skinned lady, okay? And has a beautiful tummy tuck result, okay? Has nice, smooth, curvilinear lines on the sides. Very excellent profile view, okay? Also can wear a bikini. So, you know, bikinis are still in for some people if their anatomy allows it. There are other people who do not heal well. Some people who are very pale, and I think she's a little bit more on the pale side. They're purple scar formers. That's not necessarily a bad thing, but it just takes a long time for those purple scars to go away and to resolve. They're formed as a result of capillary proliferation at the incision site, and they're just red scar formers, okay? Sometimes, and many times actually, those red scar formers actually turn out to be some of the better ones, but it takes 9, 12, 15 months for those scars to lose their redness. Other people, they just form thick scars, okay? People of darker skin, Asians, they tend to form thicker scars, and that's where nature comes in and genetics interfere. It's also important to adhere to the other principles that I had mentioned. Moisturization, low-grade pressure. Sometimes we have to resort to steroid injections or 5-FU injections to help knock down those scars. We can sometimes revise the scars and then apply these other ameliorating measures to those things later. But you have to take it and see how things work. Different things work for different people. So scars generally take about 6 to 8 weeks to reach a pretty steady state, but there can be some improvement over the next year or so. So don't give up on a scar. I would always continue to keep treating it, even if it's a little bit of massage to help soften it, a little bit of moisturization with some Neosporin, and the two of those go together. So I would keep on paying some attention to it for the first year or so. As far as thick scars go, you can, again, inject some steroids, some 5-FU. Lasers, YAG lasers in particular, seem to help also. You can use those to decrease the capillary proliferation and the blood vessel formation around that, so it really decreases the life out of the scar, if you will, and soften that up. Sometimes if it's just a little bit of contour or texture irregularity, you can use a laser to resurface it and smooth it. That's for fine tuning. Some people come in and they say, well, should I put a tattoo over this scar? And my answer is never. I don't really like tattoos that much. We can certainly take them off for you. We have a great laser tattoo removal machine here. But I think covering a scar is counterproductive. The tattoo is way more visible than the scar usually ever is. So in general, I would say no, don't do that, but it's up to the individual. So we generally monitor scars for several months, up to a year or so. And if you're not happy, we can always revise that scar or revise portions of that scar so that those portions are better. Personally, I think that if you just revise a portion of a scar or the scar itself, you're going to get less inflammation because that operation is a much smaller operation, much smaller in degree. Therefore, you get less inflammation, less overall wound healing, stimulus, and therefore, more than likely, it's going to be better than it was before. So some people ask about eliminating a scar, and the answer is you really can't eliminate a scar. Whenever you make an incision, there's going to be a scar there. Our goal is to make it as imperceptible as possible. So, we can help you along the way, tweak it, make it less visible, but I think eliminating the scar is not really a realistic expectation. So there you have it. Talked about abdominoplasty scars, tummy tuck scars. Hope you enjoyed this video. Make sure you like and subscribe, and we'll see you on the next video. Thanks.